Welcome to Courtney on Health, exclusively on malcolmpresents.com, a streaming network producing its own. Well, now it's going to be 20-minute programming, for your entertainment and education. Welcome, guys.
Hello.
Welcome. We're focusing on education, I think, and we could try to throw in some other stuff, but in a small amount. So hi Courtney, hi Malcolm. Welcome to Courtney on Health, the Zoomcast podcast on YouTube series, which focuses on one's overall well-being with tips on nutrition and exercise given by Courtney Gravenese, registered dietitian and exercise physiologist. And she's an experienced nutritional and health consultant in the New York metro area. And of course, in this world of social and internet and all that stuff, beyond that, so it's all cool.
And beyond. And what's our topic beyond. Today?
And she's gonna she's gonna guide us on a path to wellness and health, and we're gonna talk about something involving gluten today. So we all love bread, cake, pasta, pastry, but those foods usually contain gluten and is often associated with wheat and wheat containing foods that are abundant in our food supply. But people are becoming more gluten intolerant. And the question is why? And what can we do to manage our gluten intake? According to Mom's Place Gluten Free, a website, prevalence for gluten intolerance or gluten allergy is 9 times greater today than 50 years ago. Dr. David Billstrom, who's a doctor of functional medicine at the Bingham Memorial Center for Functional Medicine and International Autoimmune Institute, stated that it's no longer a question of if someone has gluten sensitivity or health issues. It is a question of when. He indicated that 80 to 85% of the population would benefit from eating higher quality foods, avoiding processed foods, GMOs, and preservatives. He further went on to say that it really comes back to we are what we eat. So let's turn to Courtney to give us some info on the story of gluten and what we need to know about being gluten-free. And also there's, people who are gluten-free have issues, but it's gluten. I'm going to ask off the top, is gluten something we need though? I mean, or do you want to get to that after?
That gluten is in. So you touched on it. So gluten is a protein that is found in not just the sweets and the pastries. It's among extremely healthy grains as well. So all those grains that we talk about on the show, like all the time, it's in those. So could we live without gluten? Sure. Are we clipping out a very large category of extremely healthful grains? Yeah. So I don't know if I think it's a when. There's millions of people who don't have either a gluten sensitivity or celiac disease. So I want to talk about the separation between those two. So it's a protein. It is found in many grains like rye, like barley, like wheat, and of course anything made with those foods. So not just breads and pastries, but crackers. It's in soy sauce. It's in beer. So think beer, hops, grain. It's going to be in there. Now there is a line of gluten-free beer that's available now that people can choose, but it's in more than just what we would consider just baked goods. Anything like soups or gravies that use, anybody who cooks out there knows, to thicken a sauce, to thicken a soup, oftentimes you will use flour. Now, of course you can use cornstarch instead, and that would be an option. So anyway, think a little bit more about those foods as options, as foods that would be containing gluten.
But wait a minute, is rice flour okay?
Rice flour is fine. I'm going to go through a whole list of the.
Courtney's going to give us a list. Okay.
all the list. So
okay.
Let's talk about the 3 million individuals out there who have something called celiac disease. So this is more than just an intolerance, and I don't mean to say just, that's not fair. It is an autoimmune disease that triggers your body's, it's an immune response anytime your body ingests gluten. Anytime you ingest gluten. The problem with that is that it causes damage to the lining of the small intestine. So it's not really a latent response you're feeling. Typically, people with celiac sprue are diagnosed the most reliable way is through an intestinal biopsy. So these individuals really need to, it's not an option to reduce gluten. It really needs to be completely eliminated from the diet entirely.
What are the symptoms?
So
I mean, how do you know? What are the symptoms to that?
A lot of pain. It can be in very short order, things like diarrhea, discomfort, like I said, pain. And the usual first step would be to go see a gastroenterologist. They start with a blood test first. But like I said, the ultimate, and this becomes a problem in kiddos, because the last thing you want to do with a little kiddo is have them go through an intestinal biopsy. So many times if I'm working with a client, it's like, let's pull it out and see if there's any difference at all, right? As opposed to, so that's celiac sprue, that's an autoimmune disease. And then there are individuals who have an intolerance or a sensitivity to gluten. And for some of those individuals, they try to eliminate gluten from the diet to see if there's any difference in how they feel. Now, their symptoms could be bloating, it could be just discomfort, it could be a lot of gas, it could be constipation, it could be sort of a mixed bag of things that they may be experiencing. So in those individuals, it's not this, you must remove it, it's give it a try. And I would often say to those individuals, you can't just give it a day or two. It really does need to be a 3-month, period. Give it a go for 3 months and see if you feel any different. And if you do, well, then maybe there's some benefit to keeping gluten, foods that contain gluten out of your diet. If you feel no difference, chances are your symptoms are not due to the gluten, it's due to perhaps something else.
Something, Courtney, as you're talking about the symptoms.
Yeah.
It seems like everybody that I know has some variation of those symptoms, whether, especially as we get older. I'm just wondering whether that these people or that there's more gluten intolerance that we really don't know about because it's not diagnosed. Like I have irritable bowel syndrome.
Mm-hmm.
But no doctor ever said, well, why don't you avoid gluten? And that's all the symptoms.
Well, chances are they might, from their experience, know that it is not the gluten. It might be the context, and I'm not saying this is you, Malcolm. It might be just the context of the diet. So Maxine, you were mentioning this, I think he was a researcher or a doctor who said, our processed food, the American diet has got a little bit of wiggle room, let's be kind, for improvement. So maybe it's not the gluten per se, maybe it is the way we are processing our food. So what is the cause of this rise in gluten intolerance? Let's take celiac sprue out of the mix for the moment, of the gluten intolerance. Well, maybe it's not, maybe gluten's always been there. So what's the change? Well, maybe it's the way grains are, and this is one of the hypothesis is that the way we grow grains. Maybe the gluten percentage is greater. Remember, gluten is what gives that texture, that chew, that wonderful mouthfeel to a lot of the grains.
Bread.
So things have, but different flours have a different gluten component to them. So maybe, Malcolm, it is the way we grow our grains now. That's one possible theory. The other theory is because it's not just the grain itself, it is because it has been so highly processed, we might be doing something to the type of gluten percentage that's in that food. So nobody really knows for sure. But I always say, give it a try. If you truly believe that it is due to gluten, there's, again, as long as you're making healthy choices, because sometimes when I'm working with somebody, they'll take gluten out of the diet, but then they'll go for, and you guys have heard me use this phrase before, crappy carbohydrates. They'll go for sort of the crappy carbs that they're gluten-free, but there's no nutrients to them. They're not bringing anything to the table in terms of, nutrition quality. So make sure you're choosing just the better quality gluten-free options that might be available to see if you're feeling any different.
The vegan diets have a lot of grains and a lot of spelt and wheat berry and farro, all this stuff. And you just it's hard to focus on your brain if you're a vegan and want to be that, but you're also, if you're gluten free, then what do you eat?
Of course. Yeah,
It's
yeah,
just
you're right. You're absolutely right. So, so let's talk about those, the ones that you can eat. But so before I go into there, just really quickly, and this is important. So if you've got you yourself, or you've got a kiddo, and you believe it might be, again, celiac, and your healthcare provider will tell you this. Hopefully they will remind you this. What happens when I see sometimes with clients is that they will try to go gluten-free before they get their testing done. No, you have to, what we're testing for is to see if you're having this reaction to the gluten, yeah? So you want to continue the diet as is with gluten in it before you go in for any kind of testing. So that's important. There's labeling now. It's voluntary at this point. But as opposed to 10 years ago, where gluten-free really meant nothing. If you put gluten-free on a product, you see gluten-free on a product, it means something now. And what it means for the person who's trying to cut back on gluten is that that means that that particular product, whatever it is, has less than 20 parts per million of any gluten-containing components to it. So it's not zero, but from a research perspective, it's low enough to be, it's close enough to zero to be considered completely gluten.
Yeah, I hate to be the pessimist, but more of the time when it says gluten-free, it means it's X% more than something with gluten. The gluten-free products seem to be
Say that one
very
more time?
expensive.
Oh,
what?
yeah. Yeah, the price, you mean, when they're,
Yeah.
yeah. Let's talk about, if certainly there's a wide category of foods that wouldn't never had gluten in them to begin with, right? So fruits and veg, and lean protein options and beans, so eggs. These are all, they're naturally gluten-free. There's nothing been done to them. The grains that are going to be gluten-free are things like quinoa. Many people are familiar with quinoa, and I have noticed that it's more widely available in grocery stores, which is helpful for people trying to keep gluten out of the diet. Yeah. A grain called sorghum, buckwheat, amaranth, teff, of course, corn. So corn, think corn tortilla versus flour tortilla. Or anything made with corn flour.
You
is
said
going to be
buckwheat?
a good option.
Buckwheat?
What's that?
Buckwheat. It has the word wheat.
I
Buckwheat.
know.
How was
It's a
that?
little
Isn't
confusing.
that was like
I know.
I love buckwheat, so yeah.
Yeah. And then of course, rice. So you asked before about, there is certainly rice vinegar. There's, white rice, brown rice is going to bring a little bit more fiber and certainly some vitamins, more vitamins and minerals to the table. But either of the rices are going to be fine. So that's an oats. Oats is a tricky one because I feel like the messaging about oats is a little bit confusing. So oats on their own are gluten-free. They are a gluten-free grain. The problem with oats is that the way they are processed and harvested sometimes leads to some cross-contamination. So what I would suggest to either somebody with celiac or somebody who's trying to watch how much gluten is in their diet is to look for an oat product that actually says gluten-free on it. Now, again, most oats are, and you should not have a problem with it. But if you want to be really sure, just look for that labeling. But oats are considered a gluten-free option, a grain.
Right.
So there's gluten-free beer out there that you can choose. Tamari is that's Tamari, is a wonderful substitute for soy sauce. So if you're trying to do, cooking that involves soy sauce, there's certainly an option for you without having to use the soy sauce, because that does have gluten in it.
Yeah, tamari is a definite option. I know that people with, gluten-free. I know a number of people who can't have gluten, and I feel, I can't have that good, real nice bread or something, and it's just it gets to me. I'm like, sorry about that. I mean, but there's plenty, as you said, you can certainly eat, and you can certainly have enough to keep you going. So, but that's the way it goes.
And I will say, and I know we're coming up against our time, the good news is, I would say, certainly 15 years ago, there was just a complete lack of options for folks looking for gluten-free products, because, gluten-free breads were terrible. You know, I hate to say it, but they were. But over the years, they've gotten better. There's a process which you can remove the gluten from from wheat containing products. So that helps. So they've come a long way with options like there's chickpea pastas and things like that. So there's a bigger variety for folks who are choosing who either choosing to have foods without gluten in them or really cannot have gluten in their food. So that's good news for people trying to give it a whirl.
Right. I mean, I was in this small town, I don't remember the name, in Scotland where the Beatles kind of hid out. So it's become a tourist spot. But there's a really great this old bakery there. And when I went in there, they had gluten free. It was like in this little bakery in this small town in Scotland, they had, gluten free options there, because I guess, now there's tourists that are there and people can't eat it. But I was surprised to see gluten, it was right up front. If there's gluten free, let us know. We have other things. So that's something that is on the map that stayed in my brain when I went there.
Absolutely, and you're bringing that up, and I know Malcolm, I know, is going to give us the hook, but for people who are celiac, who absolutely cannot have any type of gluten, things like separate toaster ovens, toasters, in some cases separate pans, they really need to be very careful about the foods that contain gluten being in the toaster oven or the same pan. So it's something that is serious. It takes a lot of planning, but again, it can be as serious as you need a separate toaster oven, and that you can't have regular wheat toast in there. It has to be just for gluten-free products only. So, but there's lots of help out there. There's lots of resources. I'll post some when I do the post for this segment. There's lots of support out there, particularly for individuals with celiac. But if you're interested in learning about the research, about what we know about gluten and inflammation and intolerance, I would encourage people to stay up to date as possible about the information that's available.
Yeah.
Somehow it seems like gluten-free is almost the I mean, I know it's wrong. It's almost the disease of the month. It seems to have gotten a lot of more publicity in the last few years. Like growing up, I don't remember anything about any products being gluten-free or being, you would avoid, wheat products or, bread because of dietary reasons. It's fattening, but not because it had glutens. When did you have any idea of when this became so popular?
Well, celiac sprue has always been around. It's just, we're at 3 million people who have it right now. So when you think about just how many people there are in the world, that's actually a very tiny number. So it doesn't get a whole lot of publicity. I think slowly over the last decade, I think there's been certainly a lot of books published about the effects of wheat. And listen, like I said, we don't all have to eat the same. I follow the research. I follow the data. I think if people want to remove gluten products from their diet to see how they feel, they absolutely should, and have an honest log system to see how they feel. But oftentimes, and I'm just basing this on my population and what I hear from colleagues, unfortunately, they make the jump to it's no healthier, the foods that they're choosing. They're gluten-free, but they're no healthier than what would have been a product that had gluten in it. So that needs to be, that I feel like is an education tool that, health professionals can work on, is like, try it, but make sure you're choosing healthier options. So.
Right. It's the processed foods and the GMOs. You don't know, in those particular foods, what's in there. And you said, the cross contamination of things is something you have to be, very careful about. Yeah. So, but
well, sometimes you almost have to be a chemist to read these, the ingredients in any products. I mean, I've tried it and I've almost given up because half of the things that's in there, I have no idea what the hell they are.
Right. Well,
some of them sound, some of them sound scary, but aren't. And some of them are scary, but don't look that way.
that's how I feel about the world right now.
Right. Listen to the news this morning.
Yeah,
Anyway, guys.
I don't listen to the news, but
Anyway, guys, our time is almost up.
okay, so I'll do a wrap, and
Do a wrap.
that was really good information, very important, especially people who have this issue that they have to deal with. So you need to go to your dietitian. Also is a really big part of all of this. So
Sure.
Thank you, Courtney, for that. So thanks for joining us for Courtney on Health. To get more info, follow Courtney on her Facebook page, which is Courtney on Health, on Instagram and TikTok at CLG Wellness. Visit her website, which is CourtneyGravenese.com. For past shows, go to MalcolmPresents.com and theManyShadesOfGreen.com. This has been Courtney on Health, smart, sound nutrition, strong, safe fitness, and we'll catch you again next time.
Right. And again, remember, right now you're listening to Courtney on Health on MalcolmPresents.com.
Bye, guys. See you next time.
Have a great week. Bye.
Bye.